Hi, I'm Dr. Don Bonner with Personalized Wellness, and for this week I'm going to shoot a video that's going to be the first in a series of videos that I title Cardiovascular Disease in Women. And what we're going to be doing is basically talking about prevention of cardiovascular disease, what are the risks associated with having cardiovascular disease, what symptoms could you potentially have if you have cardiovascular disease, what are the causes, all of these things we're going to go into, and then we'll talk about things that we can do in our lives to again prevent the cardiovascular disease. I think this segues pretty well from the videos that I've done over the past 2 or 3 weeks, which dealt with hormone replacement at menopause. And if you've watched those videos, you know I'm a huge advocate of replacing hormones after we go through menopause, because estrogen is so cardioprotective and in preventing plaque from being laid down in our arteries. It helps increase HDL. I mean, there's a number of things that estrogen does for women, and I really believe in replacing those. Okay, so some statistics. Number one in 3 women will die from cardiovascular disease or stroke. So that's very big, folks. It is the #1 killer of both men and women. Number 2, more women die from cardiovascular disease and stroke than from cancer, respiratory disease, and Alzheimer's disease combined. And again, combined. All of those things combined. I think that speaks for itself. It's huge. And again, #1 by far. Number 3, there's 10 times more deaths from cardiovascular disease and stroke in women than from breast cancer. And I'm not diminishing breast cancer. Obviously, I believe in prevention with breast cancer also. But I really want to get the point home that cardiovascular disease and stroke is the #1 killer of women. Okay, the next thing I want to talk about real quick before I end this video is I want to talk a little bit about signs and symptoms, which are a little bit different than they are for men. For women, they tend to be much more subtle symptoms, and it's much easier for you to put them off as, oh, it's just part of aging, that sort of thing. But what I really want you to focus on is that if you're having any out of the ordinary symptoms for you, it could be signs of cardiovascular disease. And it could be something as simple as all of a sudden you're having insomnia, or you're having some shortness of breath that you haven't had before, you're having anxiety for whatever reason, feelings of impending doom. All of those things could be precursors to cardiovascular disease. I think this acronym, HEPPP, is actually a pretty good acronym. And this is from Rosie O'Donnell, who recently had a heart attack. And what the acronym stands for is HOT. So you become very hot and warm for no reason. You have no idea why. You're exhausted. And this is the type of exhaustion that is unexplainable. You just feel like you can't do anything. You become pale. You may be puking, so gastrointestinal, disorder, and throwing up. And she actually had pain, which is the final P. Some women, I will tell you, do not have pain with heart attacks. So that's something to keep in mind. The next video that we do, I'm going to talk about risk factors, which are very, very different for women than they are for men. And a lot of them are very surprising. And then we're going to talk about, in subsequent videos, we're going to talk about causes, as far as what causes you to lay down plaque. And there's a number of different causes and things that we can look at. And finally, we'll talk about prevention and the things that we can do to prevent all of those causes. Okay? So stay tuned. We're going to do a series of these videos. I think they're super important, and I think they can be life-saving for women. So I appreciate you watching the video. Please subscribe. It really helps the channel out when you subscribe. please, put some comments down below. I'll answer those as soon as I possibly can. And it's a good way to interact between you and me. And like I said, I'll answer any questions that you have. But we'll have another video out next Tuesday. I appreciate you watching. And I'm Dr. Don Vada with Personalized Wellness. Thank you.